Okay, today's morning medicine is antimonium arsenicosum. I got arsenicum, which is a normal word. I don't know who came up with arsenicosum, whoever proved this medicine, I would imagine. Now, it's a short one, so I'm going over case taking with Robin Murphy, which I did a while ago, and I'm doing it again. But he went over etiologies, and etiologies just means causes. So a lot of the etiologies are emotional shock, and that's what I'm going to do today. Emotional shock, there's a lot to it. Infectious disease, physical trauma, toxic exposure, deprivation, and deficiency when you're not getting enough fluid or food, or that kind of thing. Excesses, which whether it's food, sex, whatever it is. Genetic work, genetic factors, your history, what you inherited from your parents and grandparents, poor hygiene, environment, our belief system, and medical interventions. So those are the things. But within the antimonium group, I have arsenicum. There's like six of them, I think. Arsenicum, antimonium arsenicosum. Then tomorrow's is going to be antimonium crudum, which I've used, and I know it's a more common one and more proven medicine. This one mustn't be proven too much. I don't know, or it doesn't have it should have more uses than what it shows. But crudum is a big one, so that's going to be all day tomorrow. Will be crudum. Then I have arsenicum, antimonium sulfur auratum. Wait a minute. Antimonium iodatum is after that. After crudum is iodatum, which is iodine with antimonium. And antimonium is a metal. Uh, Antimonium muriaticum, which is muriatic acid with antimonium. They call it butter of antimony. What else? Antimonium sulfur auratum, auratum, which is golden sulfur of antimony. So there are a lot of chemicals. They don't actually always mix them, the homeopaths, but it's like from the chemistry area, they're mixing these things and utilizing them for stuff. We just took them and started making homeopathic medicines. Antimonium tartaricum, that's another one, which is a big one we use. Antimonium tart. And then that was the last one. Wait a minute. Yeah, that's the last one. So there's a lot of antimoniums. That's probably all weak. But arsenicosum is antimonium arsenicosum is said to affect preferably the upper left lung in emphysema, where the dyspnea is excessive, where they can't catch their breath. So they've got emphysema, great emphysema remedy, where they can't catch their breath. They have extreme uh, loss of breath, can't catch their breath. Mates, I guess a doctor, says it is equally effective in right-sided cases in old pneumonias and catarrhal pneumonias in children, in old pleuritic effusions, and in pericardial exudations. The pericardial this is all lungs and heart stuff. So it's very good with all that. So the medical is, let's see, do I have it all up here? Let's see. Let's just go up here. Antimonium arsenicosum, it should be. Arsenite of antimony. Upper left lung emphysema with excessive dyspnea. That's a 3. There's a lot of they can't catch their breath. They have almost like an asthmatic thing going on. Exudation from pleurisy and pericarditis. What is exudation again? Exudation, I'm pretty sure, is I get out of here. Things coming out. What is exudation? I usually have this stuff looked up ahead of time, but I didn't. Fluid that has leaked out of blood vessels into or nearby tissues. Huh, that's interesting. So this has to do with the lungs. So you have exudation, which is leaking from the blood, proteins in that, from pleurisy and pericarditis, which pericarditis, I'm pretty sure, is the heart stuff. Where do I have that? I know I looked that up. Mm, pericarditis, and this is something you can do. You know, it's a lot of these terms don't really affect how I would, as you'll see, I'll show you, uh, affect how I would, uh, sorry, how I would. I got some mucus wanting to come up. How I would prescribe, you know, exudation. How do I know that there's stuff leaking out into uh, the lungs and that from the blood vessels? Pericarditis is swelling and irritation of the thin sac-like membrane surrounding the heart. Yeah, that's what I figured. It's heart stuff. So we got heart stuff with stuff leaking into it. That exudation is big, but how would you know what's leaking into what? You know, you don't have, unless you're a doctor and you can do all them tests and stuff, you don't really need that. Emphysema with excessive dyspnea. They can't breathe and I know they got emphysema, or just they got this hardness of breathing. Now, what am I pairing that all with? If it's the left lung, I would be thinking of antimonium arsenicosum, but I wouldn't give up if it's the right lung either. Cough, worse eating. That would be a nice uh, symptom that I would utilize. Myocarditis and cardiac weakness. So there's heart stuff with lung stuff. So that's a concomitant. And concomitants, clams. Concomitants, location. E is etiology. M is modalities, what makes it better or worse. Clams and sensations, what's it feel like? So that's all. That's mainly what you're going for. What, you know, all these terms and all this stuff, it won't matter much for you. With you, you got, now you can utilize it if you're a doctor, you know. Inflammation of eyes with edema of face. So there's another one. They got swelling of their face and their eyes are inflamed with this lung stuff going on. You know, that would draw me, you know, when I would go to look things up, it would draw me to these medicines. And as you'll see, a bunch of other medicines I'll show you. Wandering pains in sciatic nerve. So there, it could be a sciatic remedy. Now, I took Aeschylus last night because my left-sided sciatica was killing me. I took Aeschylus and it seemed to settle down, but it doesn't fully cure it. It doesn't get rid of it. Now, it could be a physical thing because of all the work I did all them years, which would be physical trauma. So that would be in the third category that I'll be going over, which is trauma. You know, all that work and that excessive overwork. I could be looking that up. So, anyways, it's a left-sided sciatica. I've looked that up. I've taken some medicines. I just know that Aeschylus a lot of times helps that. Now, it's helped it. It's palliated it. Let's say it's almost like taking ibuprofen. You know, that would palliate it. Sorry, that would palliate it too. It takes ibuprofen takes the swelling down. And I took Aeschylus instead because that doesn't destroy my stomach. It's just a little sugar tablet, and that seemed to alleviate it for a while. But it doesn't fully cure it. So I have to keep looking to try to get it. Just like my wife's legs, I can't figure out. And it's worse damp weather. Now I gave her Leadum last night to see, because as I keep looking it up, I'm not hitting the center of her problem. And once I hit it, all that'll clear up, you know. Wandering pain, sciatic nerve, catarrhal pneumonia associated with influenza. Now, they do say, like he said in here, you know, people who had old pneumonias, so someone who had pneumonia in the past and then they still have this emphysema type of dyspnea, you know, lack of oxygen they're getting, that'd be something to consider for our antimonium arsenicosum. And old pneumonias and catarrhal pneumonia in children. So that is, let's see, is there anything else I want to say about that medicine before I get into the other stuff? Cause inflammation of the eyes. Okay, I got all that. Okay, so you'd compare it to the other antimony salts, like I just showed you: crudum, tartarium, sulfuricum, aurum. You know, it's all mixed with different other stuff. You know, that would give it a different symptomology, basically. So you go with crudum for certain symptoms. You go with arsenicosum for other symptoms. So, anyways, Uh, and then it's also compared to arsenicum, aurum metallicum, lachesis pulsatilla, and wandering pains sulfur. So that is, oh, pulsatilla is the wandering pains. Yeah, because pulsatilla has a pain in the knee, right knee, pain, and then it goes to the left shoulder, then a pain in the right elbow, so it wanders around. That's pulsatilla. And you also can consider antimonium arsenicum. You can consider sulfur with that. Okay, so let's get into etiologies. What is an etiology? It's a cause of what happened, whether you had a car accident, an emotional shock, which is what I'm going to go over today, from someone dying or losing a business or losing all your money or whatever it is. So the etiologies or causes. The first one I'm going to do is emotional shocks. I think in a day or so after crudum, I think I'll get into infectious diseases. Every time I have a small medicine like this, it's good to throw in some other stuff. So, emotional shock. What are they? They're grief, abandonment, or mortification. So, all right, let's just go through it. Loss. You lost someone, or the finances, or the property. You know, uh, Sora, which is a miasm, Sora predisposes us to this. And we all have Sora, being that we were born into this realm, to unhealthy attachments. So that's, if you lose someone, yeah, grief is normal. You grieve for a moment and then you're over it. You lose your, like I, lost my business, lost my, lost a bunch of things. You grieve over it for a little bit and then you move on and you keep going. Now, the Sura, though, predisposes us to an unhealthy attachment, which causes us to keep running the loop of, I think it's first is anger, then I don't know how it goes. Disappointment, then anger, then you go into acceptance, then you go into, I don't know, there's a whole grieving process you go through. Now, if you get stuck anywhere in there, then you need to get some medicine. So, with this loss of someone, finances, or property, so you lost something of value to you, whether it's a person, a thing, uh, anything like that. So, a business, carcinosum, causticum, ignatia, and natmur. And you'll see a lot of these overlap each other. So causticum would be burning. Ignatia is a very big depression. Natmur is a same thing, kind of a depression. So these all have keynotes that you would, if you looked at up somebody that lost something, whether it's someone, finances, property. Now, ignatia would probably be to someone. That's usually a grief of loss of someone. Now, these other ones could be of the property and finances and things like that. So you look up loss of something, you'd get these, at least these four medicines. Those are the four big ones. There's other little ones. These are threes. There's other ones that are twos, and then there's other ones that are ones. And it can be quite a large list of remedies. But from their experience, they say these ones usually work in this condition. So the other one is forsaken, feeling of abandonment. So within this emotional shock, there's many different areas. Sorinum, which is the Sora, basically produce. Anyways, pulsatilla and argentinite. Pulsatilla would be a lot of weeping. Sorinum would be a lot of skin things going on. The mental I'd have to look up. And argentinite. So those three, and they're totally different. There's none of the ones from the last one in there. Now that's from abandonment. Abandonment can be you were adopted. You felt, now when you find out, you feel abandoned. Or it can be your parents are never around. They're always on vacation or working or something. Um, Different things like that. So, mortification, which is like humiliation. I just remember Tony's mom would call him and he'd be out of town and he couldn't answer her back because he didn't have that service. Back then we didn't have where you had a cell phone, you could just automatically do it. It would go on an answering machine, and his mother would always say, I am humiliated. She would always say that. You act like you're the president, you can't get back to me. And it was in a condition he couldn't. So she always would say that. That humiliation is someone teasing you in school, someone beating you up, picking on you, whatever it is. Now there's a batch of remedies for that. Anacardium and carcinosum, which you see is in this one up here. Cholesynthesis, ignatia, which is up there also. Lycopodium, Natmer's up there with the loss of finances and that. Palladium, phosphoric acid, and staphysagria. So when you look up this humiliation, whether they're being beat up or they're being teased or they're, I don't know, they go into work and they don't, the boss, basically humiliates them. These are the medicines that would come up. Now you have to do like we did up here, what is the symptoms, and then match the symptoms to what's going on with the person to get, once you get this set of remedies, now you got to narrow it down to make it more manageable to see which one actually fits. Fright, and that comes from the case you take, from getting the symptoms off that person with their vital force is throwing out. And it's surprising that the emotions can cause physical ailments, can cause, these different symptoms and things to go on. Ailments due to fright. So any kind of fright, whether it's an accident, an injury, we know what fright is. Arnica, ignatia, calendula, gelsemium, aconite. Opium is deeper, so it's a deeper when they have a fright and they're just, they can't function now because of the fright. You probably go right to opium. But any one of these. Now this fright, arnica, could be, like I said, an accident. And that accident, their injury isn't bad. Now, okay, so let's say a kid falls and hits his knee and he's crying and crying, and it's not so much the pain, but it's the fright of what happened. That's when you would think of, that's where a lot of these would come in. If it's the pain, then you'd be thinking arnica. Oh, he's, it's the actual pain that's got him. But if it's just a fright, you can still use arnica and ignatia and all these. So aconite's a big fright remedy, anyways. I can't get it. What time is it? I can't get in too deep here because I will run out of time. So bad news, ailments due to. Now you think about it. Someone calls up and says, hey, your sister died, and you don't have a sister, it doesn't affect you. But that bad news, just like getting cancer, you could have cancer and I know people that had cancer for a long time, and they went and got a diagnosis and died weeks later. So that news is such a shock to the system that it produces a bad situation for you that causes you to really progress in your cancer or whatever it is. So you get bad news about someone that died, you get bad news about your health, you get bad news about your business, any kind of bad news. Calcarea carb, gelsemium, and ignatia. Now gelsemium, there'd be, the usual symptoms of gelsemium, which is they're low energy, they're weepy, their eyes are dull looking, their lids are half masked, they just aren't moving, they don't care. Gelsemium, calcarb, they're more plump people, and they would have different symptoms than gelsemium. And ignatia is more like a depression from the bad news, and they're just disappointed and all that. So F is disappointed in love. Arm metallicum, which is gold. Now that's gold. Where is it? Up in here? Loss of finances and that. I'm surprised arm metallicum should be up in here too. With loss of, gold, you think of, anyways, that should be up in the loss of finances, it seems. Hyoscyamus, ignatia, phosphoric acid, natmer, and staph. So you got these few medicines for disappointment in love. They ask someone to marry them, and then they falls apart. You would look at up and you'd come up with these medicines. Now you would have to match their symptoms that they're going through with the symptoms of each of the medicine to figure out which one is actually the right one. Worries, ailments due to anticipation. So whether it's a test coming up or a big business deal, or I don't know, whatever it is, you have worries. Arsenicum, calcareous carb, and as you can see, it's bad news. Calcareum carb is there, ignatia is there, ignatia, calc, and all them. They're nux vomica. Staphysagria. Staph's in a lot of them, with this bad news, disappointed love, mortification. Staphysagria should be somewhere else. Anyways, but you can see they overlap a lot. Nux vomica, phosphorus. So these ones in that anticipation. You're anticipating something going to happen, and you have sleeplessness, and you have this and that. So you take their symptoms, then you'll go in, you figure out what's the center of their case. They're worrying. They're worrying about what's coming, and it'll come out. You'll see it. So then you look up ailments due to anticipation under mind. So you go into mind, and that's where a lot of that would be. Where's that mind? It's of course M, so you gotta go alphabetical. I was looking up legs for my, see, and there's mind, in the repertory. So you go under mind, and you go under, let's say, depression. What do I want? Anger is another one. Anger's coming up. So as you can see with anger, if I can get it there, there's just a lot under anger. Anger starts, it's got 1, 2, 3, 4 sections, all in anger. And it breaks it down. Suppressed anger. So suppressed anger, let's see, violent anger, vexation, fright, anger with fright. Um, they've just got a lot of, it breaks it down into different categories. Anger ailments from. So that's which, if I look under there, platina, opium, and staphysagria are the 3 under there. So that breaks it down to 3 of them if they have anger from ailments from anger. That breaks it down a little bit more so that I don't have to go through too many of these medicines, you know. So anyways, worries I did. Overstudy, ailments due to mental work. That's what you look up under the materia medica. Yeah, know this repertory to get to the medicines, which is in the materia medica. So I have overstudy, and they have ailments because of it. I go under mind in the repertory. I get down to ailments from mental work. Then from there, I find these medicines are indicated in there. They're all 3s. They're all big medicines. I go to the materia medica now, and I begin to look up these medicines, like say aconite, or what do I got? Cupra. Let's get to one I can get to easy. Well, that's with anger. I go to aconite. So then, if I look under anger ailments from, and I haven't gotten there yet, but I go to aconite in the materia medica. After I went, this is all from the repertory. So I get anger ailments from the repertory. I get all these. I go to aconite. I look up the medicine after I've taken their case and figure out what they got going on. Then once I've figured that out, then I go to the repertory, and even like overstudy. I go to the repertory and I look up ailments from mental work. I get all these medicines. So now I have to narrow it down. If there's some uh, like headaches from overstudy, then it would narrow the medicines down a little more if it's in there. But anyways, mental work, Cupramed, Kali I, Nat Carb, Silica, and there's staph again, tuberculosis. So staph's a big one for all these emotional, mental things. Anger ailments from aconite, chamomile, cocculus, cholesynthesis, nux vomica, opium, patina, staphysagria. Now it sounds like I'm very intelligent. I know these medicines, but it's been 30 years, and I still would have to look up some of the symptoms for these things. I don't, I don't keep, it's hard to keep all that in your mind. That's why them 2 books are so handy. I look up anger. This person, I take a case from them and I say, what's going on with you? How are you? I always say, what's going well with you? That throws people off. What's going well with me, man? I come to tell you what's sick with, what's going wrong with me. So then they have to, kind of, it's a technique in health coaching to scramble them, to throw them off their game for a minute. So then they tell you, well, I'm doing all right. I have a house, I have a car, whatever. They tell you what's going good with them. Now, okay, what did you come to see me about? What's wrong? And then they start into their problems, and now I have to discern between all that's going on, what the theme is. And that's what you're always looking for. What's the theme of this case? Because they'll come in and say my back's killing me, but they don't, they're not relating it to their PMS, or my lungs are, oh man, I just, I can't breathe, and this and that, and it can be related to gastric stuff, as you see with this case. It was emphysema and heart stuff. So heart and lung stuff are related. Well, my lungs, but man, my chest hurts up in the left side, or with the upper left lung, and it's killing me. And I have, I can't get my breath. You get things like that. So you've got to determine what is the center of this case. What's the theme of this case? So if they have anger and they come in and they're saying, yeah, I've got stomach issues. I've got, I'm very fearful, or whatever. Stomach issues could be nux vomica. It could be any one of these, really. So you're relating to what this anger. What is it doing to the person? What is it? What is the ailments coming from this anger? And then once you get their case and you figure out what it is, then you go to the repertory. You look up ailments from anger, which is what I think I just showed you that. And then you get these medicines. Now you take these medicines, you go to the materia medica with these medicines that you have, and you start looking them up. A lot of times you have in your mind, this is fright. Chamomile, they're very, they don't know what they want. They want something, and then they throw, I don't want that. I do that. What's some of the other ones? Nux vomica, stomach issues and headaches and things, just like a hangover, from almost like a hangover from the anger. Opium is they're dopey, and they're, so staphysagria, they've got a lot of stomach issues also from not fighting back, is usually what that is. Cholesynthesis is from, they will fight back. So that's why the guy had a cancer case. That I love this one. So I continually use it because it's so blatant on how it works. He come in for cancer on his ear, and then he started talking about it, and I imagine he had anger due to someone trying to take his land. But he was being proper about it. He would not fight and argue and yell. He would just, accept it. But when he'd go home, he'd boil about it, and it was really tearing him up. So he had ailments from anger. And this guy, he went in and he said, okay, he's, cholesynthesis will fight for what they want. Staphysagria will just take it, be political about it, and, suffer from it. So he went to, because when he asked us, he said, what medicine would you do? Well, what did I do? I went right to the repertory, and I looked up, what did I look up? I forget what he said I was going after the stomach. So I looked up stomach issues from anger. That's what I looked up. So it's stomach issues from anger. I got cholesynthesis, which is what came up. So and within that, it also had opium, staphysagria, and bryonia was another one that was in there. So it had cholesynthesis, and when I looked in a little parentheses, in one of the readings in cholesynthesis, it had that staphysagria, opium, and bryonia. So I said I'd go with cholesynthesis, and with the thought of these other few medicines. And he said, well, this one here, the reason why it's not cholesynthesis and staphysagria is because this guy's not fighting back. And he told us a story of another lady who did fight back, for the indignation that she was going through and she was angry about. And he said, I gave cholesynthesis because she was fighting back. So that's how intricate the case taking needs to be to determine which medicine it would be. And then you have the frustration, disappointment. So they're disappointed, frustrated over whatever's going on. Aurum metallicum, ignatia, lycopodium, nap-myrrh, phosphoric acid, pulsatilla, and staphysagria. And as you see, staph is through a lot of these, but each one has its individual different indications within that medicine. How'd they get that? They proved it. They made up, say, aurum metallicum, which is gold, and they made a homeopathic medicine out of it, gave it to a bunch of people. The ones that were susceptible, they got symptoms from them, wrote them all down. Now they know what that medicine's good for. So you go to the repertoire after the ailments from anger or frustration, disappointment. So you go to mind, disappointment in the repertoire. Then you'd go from there you get these medicines in the repertory, then you go to the materia medica and start looking some of these medicines up. Now, if you know offhand what some of the keynotes are for this, like if they're crying all the time, pulsatilla. If they're not fighting back, they're frustrated and they're not fighting back, you give staphysagria. So that's kind of how it all works. Anyways, that's morning medicine. Tomorrow is a full medicine. Antimonium crudum is a big one. That's one of the polycrysts that we use for a lot of different things. It's been proven well. That's going to be all, the mouth, the nose, the ear, the skin, all that stuff will be in there. So that's kind of how things work when you're trying to help somebody, and sometimes it can be tricky. Sometimes you can hit it just from a one keynote, like my wife's hernia. I think I got a hernia and said, oh, it's really killing me. Like a right-sided hernia. That's all I got. I didn't ask her no other questions. I always seen was, and you try to ask a question. You're always asking questions. I gave her lycopodium because like I said, I went to the repertory, right side or abdomen, hernia, and then a a small etiology was right-sided. Gave her, it said lycopodium was the only three or big one like these. Gave her lycopodium. 2 days later, forgot about it. Said, how's your hernia? She said, oh, it's better. So that's just amazing that you can hit it that quick, utilizing the books or just knowing some of the keynotes. So anyways, that's morning medicine. You can age, but you don't have to get old. Ah, man, I went over a little. Oh, well, what happened? Go off.